When you get an ostomy, no one's going to hand you a manual on how to take care of every situation that you're going to encounter. You learn how to change your bag, you learn how to empty your bag, you learn how to eat, how to sleep, how to travel, how to exercise, all kinds of things. And eventually, you get pretty good at taking care of yourself. But there's another part of living with an ostomy that I don't think we talk about enough. And it's knowing your rights and what good ostomy care should look like. I've had an ileostomy now for 5 years. I have had cancer, numerous surgeries, numerous hospital visits. I've had 4 blockages, you name it. And one of the things I've learned is you have to become an advocate for yourself because nobody's going to know your ostomy or your body the way you do. The United Ostomy Association of America, UOAA, actually created a Bill of Rights so we could learn what to expect from good quality ostomy care. Now, to be fair, the document is not a legal document. It's just an indicator of what good quality care should look like when you're receiving it. And it also reminds us that there are definitely local and national laws that can help protect an ostomate. All right, so let's talk about what you should know. First of all, quality ostomy care shouldn't be, here's your bag, good luck. You should be getting information on how to care for your ostomy, how to change your bag, and how to take care of yourself when you eventually leave the hospital. And that care should not end when you walk out the door. There's going to be changes in your body, okay? You could gain weight, lose weight, stoma could get bigger, stoma could get smaller, colors can change. There's a lot of variations that can occur post-surgery, and it's really important to understand that when you're experiencing something like this, you don't have to navigate it alone. I have a wound ostomy continence nurse. Her name is Mariana, and she has been fantastic throughout my entire journey, right from when I left the hospital and during several times when I needed to revisit her for different situations I was dealing with. And an ostomy care nurse is definitely a specialist in the field, and it's someone you should have access to post-operation. Your average doctor or nurse is going to be very skilled in medical care, but the experience that comes from a nurse, an ostomy nurse, working with patients day in and day out is priceless. The second thing I've learned is something that came up from experience. You have to learn to speak up. I know we don't want to sometimes. It's just so easy to go with the flow and defer to the medical person's opinion or perspective, but it's really important to remember that we deserve the best care we can get, and part of that involves good communication, and that means we have to speak when we need to speak. I've been in a hospital with 4 blockages, and when I went to the emergency room, I was admitted into the hospital, and I have to realize that I'm now dealing with a medical team that's not specializing in ostomy care. These are doctors and nurses who take care of a diverse patient population. And so it's important for me to make sure that I bring as much information as possible, maybe even my pouching system so they can see how that operates and what I'm dealing with. And just understand that there could be a different level of communication required when I'm working with the general hospital staff versus a specialized nurse. And make sure you ask them if you can actually deal or speak with a wound ostomy care nurse directly. I mean, perhaps during your stay, if they have an ostomy nurse that's available, you may be able to get that direct involvement and that direct engagement with someone who has the experience that we're talking about here. So ask. All right, remember, your rights don't end when you leave the hospital. We're going to go back to normal life. We're going to get back to our jobs. We're going to get back to working out, back to our relationships, back to all the engagements that we were enjoying prior to getting our ostomy and being in the hospital. So it's important that we understand where do we fit into the general population with regard to our ostomy and our rights. I think the best example is the bathroom access. When you have an ostomy, you don't have full control over when your bag's going to fill up, when your bag's going to leak, when you could be experiencing what you might consider, and probably is, a very real and urgent situation that requires immediate bathroom access. And that's one of the things UOAA helps with. They have a communication card, which makes it really easy to just show the card. It can be on your phone or a physical card. And you can show different people, if needed, the card, and that card will explain to them without you having to explain to them when you're experiencing an emergency and maybe not in the best state of mind to communicate effectively. So the card does the job of communicating for us, and it's definitely worth checking out. I actually used to carry that card for many years when I had colitis because my urgent needs for a bathroom were pretty significant, and I didn't always have time for a quick chat about why I needed to be next in line. And here's another thing you may not have thought about. Having an ostomy doesn't mean you can't work. And it also doesn't mean that your employer can treat you differently because you have an ostomy. UOAA has resources available on their website that cover discrimination and protections that an ostomate can receive due to their situation in the workplace. And they include the Americans with Disabilities Act, which is a substantial piece of legislature that supports people like us. And look, you may not identify as someone who thinks they have a disability. I certainly don't feel that way. I go about my life. But the reality is there are times where it can be a significant factor. But it's still good to know that there are legal protections in place if you have any kind of discriminatory issues in the workplace. I think it's important to understand that just because you have an ostomy does not mean you should be treated any differently. So learn what protections apply to your unique situation and advocate for yourself. And then you have supplies. When it comes to having an ostomy, supplies are not optional. Pouches, barrier rings, adhesive sprays, you name it. There's an assortment of supplies that are absolutely mandatory when you have an ostomy. And UOAA tells us distinctly that Medicare, Medicaid, and most private insurance companies offer coverage to some degree for the supplies that we need as an ostomate. So if you're having trouble getting coverage for your supplies, don't just take no for an answer. Ask for details, ask for reasons why, and do a little bit of research to see if perhaps there's a loophole in the system or if perhaps you're being fed misinformation. It's very important because your supplies are going to be an ongoing journey for the rest of your life if you have an ostomy that's permanent like I do. And if you're running into any situations that are similar to a supply issue or coverage issue, I would definitely recommend getting on the UOAA website. Check out their resources. They've got tremendous information and it's very detailed, and that can be a great resource to turn to if you're having a problem. So if you have an ostomy or you're about to get an ostomy, I definitely encourage you to check out the UOAA Bill of Rights. I'll put the link in the description, because the more you know, the better you can take care of yourself. Because having an ostomy definitely changed my body, but it didn't take away my voice. So check out the resources below. Thanks for watching.